Good morning. I am Anisha, as a nursing tutor at Emmanuel Arisa College of Nursing. I am going to present a topic, phimosis and paraphimosis. So, definition: inability to retract the foreskin over the glans penis. So, physiological and pathological phimosis. There is two types. So, physiological phimosis occurs naturally in the newborn males. The pathological phimosis is a defense inability to retract the foreskin after it is previously retractable or after puberty. It is usually secondary to distal scarring of the foreskin. Paraphimosis is the entrapment of the retracted foreskin behind the cornal sulcus. Epidemiology is up to the 10% of male will be physiological phimosis as at 3 years of age. So longer percentage of children will have only partial retractable foreskin. 1 to 5% of males will have non-retractable foreskin by age of 16 years. Then epidemiology is idiopathic, traumatic, and any infections or infestations, neoplastic or benign or malignant tumors, congenital or genetic, nutritional deficiency or excess, autoimmune and degenerative disorders or lifestyle changes, iatrogenics and psychosomatic, poisoning or toxic or drug induced. Pathophysiology is a poor hygiene and recurrent episodes of palinitis or prosthesis. It leads to scarring of the prepucial orifice. It leads to pathological phimosis. So, forceful retraction of the foreskin lead to micro tears at the prepucial orifice that also lead to scarring and phimosis. Patient with both physiological and pathological phimosis at risk of developing paraphimosis if the foreskin is forcibly retracted over the glans and not replaced afterward. Persistent impairment of venous and lymphatic flow. So, glans leads to venous engorgement and worsening swellings. As the swelling is the progresses, his arterial supply is compromised, leads to venous infection or necrosis, gangrenes, and eventually auto amputations also. Pathological phimosis may be detected in males who report painful erections, hematuria, recurrent urinary tract infection, prepucial pain, or weakened urinary system. Clinical features: symptoms, painful erections, dyspareunia, hematuria, recurrent UTI, prepucial pain, weakened urinary streams, and signs: inability to retract foreskin proximally over the glans penis. Prepucial orifice is unscarred and healthy in physiological. A wide contracted fibrous ring around the prepucial orifice in pathologic. Mullis et al. Gradings of phimosis. So, grade 1 fully retracted and it will be formation of a stenotic rings. The grade 2 partial retractable with the partial exposure of the glans. Grade 3 partial retractability with the exposure of the meatus only. Grade 4 no retractability. Paraphimosis: the foreskin is retracted behind the glans penis and cannot be replaced to its normal position. The foreskin forms a tight constricting rings around the glans. Flexibility of the penile shaft proximal to the area of the paraphimosis is seen. With time, the glans become increasingly erythematous and edematous. The glans penis is initially at normal pink hue and soft to the palpation, and then necrosis develop. The color changes to blue or black, and the glans becomes firm to palpations. Differential diagnosis: acute angioedema, allergic contact dermatitis, anasacral anasarca, balanitis, serotica, obturans, cellulitis, foreign body tunicates including hair thread, metallic objects or rubber band, insect bites, penile carcinoma, penile fracture and penile hematoma. Investigations, routine laboratory investigation and special. So, tissue diagnosis, cytological, FNAC, histology, germline testing and molecular analysis, imaging, X-ray, ultrasonography, CT scan, MRI, endoscopy and nuclear scan. Treatment, the patient with phimosis rarely require any emergency investigation, managed on outpatient basis by the urologist. Paraphimosis is urologic emergency and requires immediate intervention. Technique include manual reductions, osmotic method, puncture method, Hieronymus method, aspiration, vertical incision and emergent circumcision. Complication, local, recurrence, prosthesis, necrosis and gangrene of the gland, utter amputations. Thank you.